Hello everyone. Firstly, let's talk about oral health. Oral health is an integral component of general health, and poor oral health may lead to reduced quality of life, impaired productivity, loss of school days, and it also affects growth and development. So now let's look at the burden of oral diseases in India. There's a lopsided distribution of dental services to the patients. There's a focus on curative care rather than preventive care. Dental education and training is mostly intervention based. There's a lack of clinical preventive as well as community preventive approaches. And there is inadequate integration into existing healthcare delivery system. Oral diseases form a major portion of the chronic diseases. As you can see, in India, the prevalence of oral diseases is about 31 to 40%. There is a common misconception amongst people that you should visit the dentist only when it hurts. But alas, till then, the disease has taken its course and it reduces the quality of life and the treatment cost increases. So, as you may know, that COVID-19 pandemic has brought with it a new set of challenges. But there's a silver lining to all of this. There's a new and budding relationship between the technology and healthcare sectors. This promises an increased standard of living. So let's look at how these new technological innovations would affect developing countries like India. These innovations could be small and incremental for the developed nations, but when introduced in countries like India, these enable to fasten development as we would have jumped to a higher position in the development hierarchy, much like this frog. This leapfrogging will ultimately provide much better healthcare for all. So let's put it this way. That's one small step for the doctors, but one giant leap for the nation. We live in an era of technology where even our food delivery is modernized. So why not modernize oral healthcare delivery? Teledentistry is smart dentistry. Due to the COVID-19 pandemic, teledentistry is rapidly evolving. COVID-19 has restricted clinical dental access, due to which we have restricted non-urgent dental care, and there's a need to maximize dental access and prioritize dental care. This has strengthened the pillars of teledentistry and it has improved patient access. So what exactly is teledentistry? First, let's define telehealth. It is the delivery and facilitation of health and health-related services, including medical care, provider and patient education, health information services, and self-care via telecommunications and digital communication technologies. So, what is the definition for teledentistry? Teledentistry is the use of electronic information, imaging, and communication technologies, including interactive audio, video, or data communications, to provide and support dental care delivery, diagnosis, consultation, treatment, and transfer of dental education. Let's look at the scope of teledentistry and its various benefits. It could improve access and delivery of oral health care. Because it's a cost-effective alternative, it could lower the cost of healthcare delivery. Also, it can bridge the rural-urban healthcare divide because we can access patients at remote sites. In all, it is a broader landscape moving towards innovation, integration, and convenient oral healthcare. Now let's look at the various applications of teledentistry. We could do teledental triaging, telediet counseling, tele-tobacco cessation counseling, and tele-caries risk assessment can also be done. We could also provide dental education and oral health promotion. We could conduct a clinical practice through this platform. We could improve dentist-patient communication, and it could also serve as a useful platform for research purposes. So, what could be the various teledentistry methods? Following are the teledentistry portals. It could be via text message, it could be one way or two way. It could be a mobile based interactive session, or it could be through web based instructions, or it could be via video conferencing, or through an IVRS system. Now let's look at a basic algorithm for teledentistry. A patient would send his video, audio, or a text message to the dentist. The dentist would take the consent from the patient and will note down the chief complaint, location, duration for the complaint. If quick access to emergency dental care is needed by the patient, the dentist will advise and guide regarding the same and also refer accordingly. If it is not needed, the dentist will take a detailed patient evaluation and do a telephone or video-based teleconsultation. Accordingly, the dental complaint will be managed and treatment will be provided, or else the patient can also be referred. So, how can all of this patient data be collected? We can either implement mobile dental vans or the primary healthcare centers to collect the patient information and send it to a dentist at a remote site. The dentist can further teleconsult the patient, or he could refer to a dental hospital. The dentist could also collect the dental photographs and radiographs, and he could also forward it to a specialist if needed. In all, we can conclude and say that teledentistry is essential dentistry. It improves access, it reduces suffering, and it enhances the quality of life. And in current tough situations, it is the need of the hour. Thank you for watching.